Hello, good morning, all of you. Today we have to discuss the next sub-unit of Unit 4, that is oral contraceptive pills. As per your syllabus is concerned, we have to discuss today's session with oral contraceptive pills. There are three drugs mentioned in your syllabus regarding using of contraceptive pills by orally. We have to discuss what is, firstly, we have to discuss what is oral contraceptive pills. These are the pills. In other words, you have to call it as birth control pills. Also, you have to pronounce for oral contraceptive pills. These birth control pills or oral contraceptive pills are prescriptions, medication that prevent the pregnancy, unwanted pregnancy preventions. The contraceptive medications contains some hormones like estrogens, progestins, progestin alones, or sometimes estrogen and progestin combinations given in the oral contraceptive pills. Generally, these pills may be prescribed to reduce the menstrual cramps and prevent anemia. Some women experience various levels of side effect of birth control pills. Now, the oral contraceptive pills, there are four different types of oral contraceptive pills. First is combined pills. There is a combination of more than one hormone present in the pills. Phased pills, progestin only pills, and some emergency contraceptive pills. These are the four types of oral contraceptive pills. First, we have to discuss that is combined pills. This combination birth control pills are daily medication that contains two hormones. That is more than one hormone present in the pills, that is combined pills. It contains estrogens and progesterones, which is used to prevent the pregnancy in women. If you see these pictures, there are estrogens and progesterone combinations. 21 days, there is one medications, and 7 days, another hormones, that is combined pills. Total 28 days medications continuously taken by prevention of pregnancy. These are combined pills. Second is phased pills. Pills which phases provide different amount of hormones over 3 weeks. Means there is concentration of particular hormones are different one. That is called as phased pills. Generally, it contains only one hormone, maybe in this combination, phased pills. Third is progestin only pills. Progestin only birth control pills are daily medication that contains only one hormones. They may be prescribed if you have side effect from other types of the birth control pills or oral contraceptive pills. Then and only then these progestin only pills are prescribed by the medical practitioners. And last type of pills, that is emergency pills. Morning after pills can be used after sex to stop a pregnancy before it start. One of the best example in this category, unwanted 72. These are emergency pills, a single dose to prevent the accidental pregnancies like conditions. This is called as emergency contraceptive pills. The emergency contraceptive pills advantage: any method of contraceptives which is used after intercourse and before the potential time of implementation to provide the pregnancy. Emergency hormone contraceptive regimens are highly effective and decrease the risk of pregnancy by 75% by this emergency contraceptive pills. There are again emergency contraceptive pills are two types. It contains increased dose of the combined oral contraceptive pills. And second type is high dose of progesterone only oral contraceptive pills. These are the two types of emergency contraceptive pills. Clearly indicating that the higher dose in that emergency contraceptive pills to prevent the unwanted pregnancy. Next segment, how birth control medication work, means how the oral contraceptive pills are working to control the pregnancy. There are three mechanisms: by blocking ovulations, that is release of an egg from the ovaries, that preventing the pregnancy. Second, by altering mucus in the cervix, which makes it hard for sperm to travel further, and hard for sperm travel further. That's why there is a chances of pregnancy is very lesser. And third way of oral contraceptive pills working, that is by changing endometriums, that is lining of the uterus, so that it cannot support a fertilized egg and to avoid the pregnancy. These are the three ways where the control of oral contraceptive pills work for controlling the pregnancy. These are diagrammatic presentations of oral contraceptive pills are working. The first way, prevent the ovulations, that is estrogen and progesterone prevent the egg from being released from the ovaries. From this sides, it is prevented by this combined pill, estrogen or progesterone, for ovaries releases and ovulation prevented. Second is lining, thinning of the endothelium line. If you see the difference here, before the pills, you have to take these are thickened lines, whereas after starting the pills, there are thinning of the endometrium linings. So they are unable to support for release egg from ovary. And there is third way, that is thickens the mucus in the cervix. If you see these pictures, after pills, there is thickening of the cervix. So that's why the sperm does not reach to the egg and further ovulation was prevented. This is a way the oral contraceptive pills are work. Who should not use oral contraceptive pills? The woman with the following condition should not be used this estrogen containing birth control medications or oral contraceptives. Those are allergy to the any component of the product, unable to use this estrogen containing oral contraceptive. History of the blood clot disorders. If any woman suffering blood clot disorder, these drugs are prevented for that type of lady. The history of strokes or heart attack. If any woman or any lady suffering heart attack like problems or stroke, that medicines should be prevented. Severe hypertensions, diabetes that cause blood vessel problems, poorly controlled diabetes, severe headaches if persist, that is migraine-like pains, then this type of medication does not use. Breast cancers, liver cancers, in that condition, estrogen-containing drugs should not be taken by that woman. The oral contraceptive drugs available in the dosage forms. Because in oral contraceptive pills, it contains hormones like estrogen, progesterone, or only progesterone present in the oral contraceptive pills. The medications are available in various forms, such as pills, sometimes injection, which is given in the muscles, topical patches, and slow release system, that is vaginal rings, skins, implants, contraceptive infused intrauterine devices. These are the dosage forms for this type of medication for oral contraceptive pills. Why they contains the estrogens? The estrogen hormone contains ethinyl estradiols or mestranol containing drug moiety present as a working as a estrogen. And for progesterone, these are the drugs which is present in the oral contraceptive drug. That is norethanol, northindrone acetate. This is a derivative of northindrones. Norgestimate, Gestalt, ethindiol diacetate, norgestrol. These are the progestin containing drug moieties. Use of oral contraceptive pills, main purpose for oral contraceptive pills using, that is prevention of the pregnancy or maybe gap between two child. For gap, these oral contraceptive pills are used to prevent the pregnancy. Other use apart from prevention of the pregnancy, these drugs also used to regulate menstrual cycles, endometriosis, that is abnormal tissue growing outside the uterine linings, polycystic ovary syndromes, dysfunctional uterine bleedings. In that condition also, these oral contraceptive pills are used. How to use? Take this medication with food or immediately after meal to prevent the stomach upset. Means gastritis like condition may be occur. So to avoid that, the medication given along with food or after meal immediately you have to taken. Try to this medication at the same time each day. Means you have to take this day these pills at 9 o'clock. Means next day you have to maintain the time for medication. Generally you have to take it. So it is easy to implementation of this hormone work to prevent the pregnancy. Learn proper use of any particular brand of medications. How to use particular medications. That learning you have to learn. Follow your dosing schedules carefully. Day 1, day 2, day 3. Continuously you have to taken as per the medication orders. Now, these are the oral contraceptives are hormone containing contraceptives. In combination contraceptives, that is contraceptive medications containing both estrogens and progestins, these are the drugs which is present in the combined pills. They are most effective means of contraception with exception of surgical sterilizations. Severe type of combination birth control pills exist including monophasic pills, biphasic pills, triphasic pills or 91-day pills. It's present in the dosage forms. Combined oral contraceptive pills, how they are acting. The combined oral contraceptive pills containing estrogen and progesterone, which causes feedback of inhalation of follicle stimulating hormone and luteinizing hormones. Secretion from the pituitary gland and inhibit the ovulations. If you see in these pictures, prevent the ovulation or egg release by this, change the release of hormones and prevent the attachment of egg to uterus due to the endometrium lining, thinning of the endometrium lining of the uterus and prevent the sperm from reaching egg by thickening of the cervical mucus. In this way, these oral contraceptives are work. Only progestin thickening the cervical mucus and prevent the entry of the sperms for ovulations. Effect of uterine tubes and endometrium decrease the likelihood of fertilization and implementation of the egg ovulations. That this the mechanism of action for these oral contraceptives. Now, common side effect with this oral contraceptive medicines, that is weight gain may be possibility, anabolic effect, or sometimes both the effect, strengthening effect may be observed by continuous oral contraceptive pills consumptions. There is a chances of mild nausea, flushing, dizziness, sometimes depression also occurs. There is a chances of skin changes. These are the common side effect of this oral contraceptive pills. Now, in oral contraceptive, as per our syllabus is concerned, there are three drugs which is mentioned in the syllabus under oral contraceptive pills. That is mifepristone, pristone is the first drug which is mentioned in the syllabus, norgestrol and levonorgestrel. This is a isomeric form of the norgestrol. First of all, you have to discuss with the mifepristone. Mifepristone is a progesterone and glucocorticoid hormone antagonist. It inhibits the progesterones and the release of endogenous prostaglandin from the endometrium layers. This is the structure of mifeprostones. It contains phenanthrene, steroidal moiety. This is a steroidal moiety present in the structure, that is phenanthrene cyclopentane, ring moiety, and this is a substitution of dimethyl amino phenyl substitution at 11 positions, and methyl group at C18 methyl, and this propanyl group should be present at C17 alpha positions. This is the structure of mifepristone. The use of these drugs generally used for the medical termination of the intrauterine pregnancy. That is 49 days pregnancy. You have to, for that termination of that 49 days pregnancy, these drugs are used. It is also used for controlling hyperglycemia secondary to hypercortisolism in adult having endogenous Cushing syndromes, type 2 diabetes mellitus, glucose intolerance. Also used on surgery cannot be conducted who had unsuccessful surgery. In that conditions, these mifepristones are used in oral contraceptives. Second drug is norgestrol. Norgestrol, nothing but it's a synthetic steroidal progesterone. If you see the structure, this is a steroidal moiety present in the structures, and these are the ethyl substitution on C18 positions, hydroxy substitution, and alpha 17 alpha C17 alpha positions. This ethylene moiety is present. This norgestrol, it is used with ethinyl estradiol for oral contraceptions. It is made up of racemic mixture of two isomeric form, that is stereoisomeric form, that is dextronorgestrol and levonorgestrol, of which the levorotatory enantiomer, that is levonorgestrol, is biologically active. And this norgestrol and levonorgestrol drugs are used with ethinyl estradiol for preventing the pregnancy in women who use this product as a contraceptive methods. These are the drugs which is mentioned as per your syllabus is concerned. First is mifepristones and norgestrol and levonorgestrol. These all three drugs are the steroidal moiety. One is estrogens and second is progestin like drugs which is used in the oral contraceptive methods. This is all about with the oral contraceptive pills. And this information is useful to you for understanding the Oral contraceptive pills along with their mechanism, how the oral contraceptive pills are work to prevent the pregnancy. And the third drug is levonorgestrel. This is a levo-isomeric form of the norgestrel. This is one of the another synthetic progesterone hormones. Its action are similar to the those progesterones having the actions with this levonorgestrels, and its potency twice as that of isomeric form of the norgestrols. Means as compared to norgestrol, it is given better activity with smaller dose. And it is used for the contraceptions and control the menstrual disorders, and it is also used for the treating endometriosis. The structure is very resemble with the leonostrol, but only difference with the substitution of the groups, alpha positions, beta positions. On that basis, the structures are same one as like norgestrols. Only difference with the substitution either alpha position of beta. The dark line indicating below the plane of the papers, and this dotted line indicating the bond is upcrum when you have to observe from the observer. So this is related with the whole with oral contraceptive pills. Thank you.